Hello, how's it going? My name is Gregory Spore. I'm here to chat with you about Invega Trinza. Just to give you a brief history about my medical history with schizophrenia, I've been diagnosed with schizophrenia now for 12 years, and I've been taking many different medications. I've taken the depot, Clopixol, which is a 2-week medication. I've taken that for a couple years. I also took Invega Trinza, Invega Sustenna for a couple years as well, prior to getting on to Invega Trinza, injecting the Invega Trinza. And now, just to give you an update on the Invega Trinza and how it's working, and also detailed description of what Invega Trinza is. Invega Trinza palmitate, a 3-month injection, is an atypical antipsychotic indicated for the treatment of schizophrenia. Some say also bipolar in patients after they have been adequately treated with Invega Sustenna, 1-month paliperidone palmitate for at least 4 to 5 months. So I personally have been on the Clopixol for 5 years and Sustenna for 4 years, and now it's been almost 3 years on Trinza. And now I'm doing this video. There's a couple side effects that have come along with the Trinza. One being, since I have TBI in some cases, I'm experiencing some cerebrovascular reactions. Cerebrovascular reactions. Basically, I'm having some not as my blood level, my vascular level to my brain isn't as well as it should be. I'm also experiencing, when I go through withdrawal symptoms, neuroleptic symptoms, including epilepsy. And then also my metabolic is gradually sustained. So when I was on Trinza, or when I was on Sustenna, believe it or not, I gained about 150 pounds, and I went up to 355 pounds. And then I started working out and everything like that. I lost 80 pounds on the Trinza. I lost 80 pounds after working out and being on Trinza. So right now with the Trinza, I'm having a hard time sleeping without oral medication. But I don't attribute that to the Trinza. I attribute it to it was working great for a couple of months, and then I changed my pharmacy. So it was actually due to the programming and the organization that I was with. So I changed the pharmacy, and I couldn't sleep anymore. Chose not to take the oral since too much metabolic weight gain. When I take the oral medication, I tend to gain a lot of weight. And right now I'm sitting at about 300 pounds, and I work out regularly, but I don't want to gain any more weight. The Trinza is good for schizophrenia and bipolar disorder, in my opinion, and can be used as a great mood stabilizer and biologically friendly, although it seems to fall short a bit of 84 days, which is the recommended dosage. Usually I need to go get it within a week earlier. And right now I am on a separate program called Patient Evolution Program, which is way better than the public health care, which I don't qualify for. And although they compete heavily with the programming with the patient evolution program is way better than being on regular public healthcare. One thing is that they like to give it in the ventral, which I don't agree with, because when they're giving it in the ventral, gluteus ventral, it can actually get injected into a blood vessel. And if that happens, which it has happened to me before when they give it to me in the ventral, then you become catatonic for 7 to 8 days. And it's hard to get out of bed, and like it's almost like overdosing on Trinza. So don't get it in the ventral. You should always get it in the glute medius or the glute medius, which is your maximus is like this, and then your medius is like this. So maximus here, medius there. So get it in one of these two medius spots. And so, that's about it with that. And I would recommend the medication. Since it's required for me to be on medication, I have chosen to be on the Invega Trinza. I'm looking forward to possibly being on the Invega Half-Year when they do actually come out with it. And I'm hoping all the best. I hope this helps you and whoever else is thinking about taking the medication as a testimonial, because I know it's helped me quite a bit stabilize with schizophrenia. And so if you have any questions, feel free to leave them in the comments, and I'd be happy to respond with anything that you might want to know about it. Anyways, God bless and good luck.